as the Medicaid Director for the state of Washington. I think I would say really being prepared and thoughtful about how we approach the unwind of the public health emergency. The public health emergency is not ending, but we received information from the federal government that we need to start thinking about redetermining people's ability to stay on Medicaid, which we haven't done for the last 3 years. And I think Sue Birch mentioned it this morning. We want to make sure no one loses coverage. And we also heard that from some of the legislators just now, that their priority is to make sure people who have had coverage for medical insurance don't lose that. So I think these next several months will be really important for us as a Medicaid agency to do that. Behavioral health, we could talk all day about the needs and priorities there. And I think we have a lot of things that we're doing, more than probably your listeners want to hear right now. But I think there is a lot of work on the 988 crisis system build up and response. I think there is a lot of discussion about the need to really focus on all the overdose deaths, particularly related to fentanyl. I think a huge issue is focusing on children's mental health and how to support them. And I think it's giving each other the permission to say, behavioral health is all of us. It impacts all of us. We all deal with it. And so let's stop talking about they have it, they don't, they're worse, they're better. Let's just be kind and figure out how to help each other. The public health unwind basically means that our agency, along with DSHS, will have to redetermine over the course of 12 months whether or not 300,000 people that were added to Medicaid are still eligible beyond that. And so every month, that divides to what, about 30,000 people a month, a little bit less than that. So we'll have to reach out to that number of people and say, okay, are you still eligible for Medicaid? But that's not the end. If they're not, we have to say, well, are you old enough now for Medicare? Or let's get you connected with a health benefit exchange to make sure that they can find you a plan. So it's really a lot more than just checking a box. It's talking to people and making sure we can reach them and get them coverage. I think the other thing is we have a lot of focus on our waiver renewal, our Medicaid Transformation Project renewal. So we'll have a lot of conversations with CMS this year about moving that forward and getting to agreement on the things we'd like to do and what they agree to help support us in doing. And I think, again, no conversation is complete without really trying to focus on the behavioral health piece.